Care Strategy Lab. I'm your host, Miriam Allred. It's great to be back with all of you. I hope you're having an exceptional week. Today in the lab, I'm joined by Gabrielle Pumpian, who I'll be calling Gabby on today's episode. Hopefully all of you are familiar with her and her work. She's been kind of up and coming in the industry the last couple of years, and we've interviewed her on past shows, and it was time to have her on the Home Care Strategy Lab. She has experience spanning from home care assistance, Turned the Key, to Cheer Home Care, to Breakaway 365, and now she's up to something new and exciting, which we'll talk more about today. Gabby, thanks for joining me in the lab.
Hi, Miriam. Thanks for having me.
Let's start with your background. I just kind of rallied off like a few names and titles, but I want to hear more about your personal journey. Maybe share a couple of highlights like pre-home care and then how you landed in home care.
Sounds great. Well, thank you for having me. I'm honored to be here promoting the sales and business development side of this amazing industry. That's where I've been my career the last 17 years here in San Diego. And I've journeyed through being a junior with zero sales experience, pounding the pavement, really learning from the ground up, all the way through starting a brand new home care agency in a very saturated, impacted market, being the chief growth officer at Cheer. So it's been a journey, but I'm tried and true to sales and business development, and I'm excited to talk about that a little bit more today.
Yeah, let's give us a little more juice on like your early days, because today we're going to talk about like the role of the sales rep, and you have been there, done that, seen a lot, experienced a lot. So tell us a little bit more about like your early days in sales.
I'll have to think way back to 2007. I joined a already established home care team that was a part of a larger company that had home health and then eventually added hospice. So from the beginning, I was thrown into a role that was really collaborative, and my sales leader encouraged me to co-market with my home health partner out in the field, which was great because I didn't know what it was like to walk into a hospital and ask for the case manager. I didn't know what a skilled nursing facility was. I had no idea what I was doing. So being able to go out early days, co-market, really see how someone who already has a relationship established with a key influencer and account that can refer business and how they build upon that, what their intention is. So I was just super observant. I also had a great sales leader at that time who wasn't local to me. She was in Orange County and I was down here in San Diego. So I had a lot of autonomy, which taught me how to kind of develop my own style, routine, processes. But then she would come down and provide support through a ride along, meetings with the team, and we would always kind of celebrate our success, even if it was teeny tiny, and with the internal team. So she was a great example of really what a home care agency ecosystem looks like with all the different people. And when you're out there in the field and you're not spending a lot of time with your team, having someone help you bridge that gap really helped me succeed because I'm nothing without my internal team and we're nothing without our caregivers. Yeah.
Did you have personal home care experience or familial home care experience, or this was all net new to you at the time?
It was so new. So I was working at the front desk of an inpatient rehab center in a local hospital where we would have inpatients, but then also outpatients would come in for their PT, their OT, and speech therapy. And so I had a background in customer service working in high-end restaurants in college and high school. And then when I moved to San Diego after college, I was encouraged by someone to go work in healthcare because I could apply customer service to this job at the front desk. So that was my initial understanding of healthcare, was through that lens, being in that setting, and then seeing these representatives coming in and helping the case managers create discharge plans for them to go home and all the services that it takes to get someone home, selling oxygen and selling equipment and home health care and all these different services that it took. And that's how I started developing a relationship with these reps because I was the gatekeeper. I was the front desk person. I was the person they had to get past. And so when I transitioned into a salesperson outside in the field, my first person that I would ever spend time trying to build a relationship with was the gatekeeper, whether it was in a facility, whether it was at a senior living community or in a doctor's office. I never looked past the gatekeeper. The first couple of visits were always about building that initial relationship because I had been in those shoes. So Yeah, home care was brand new. And then now I'm actually a sandwich generation caregiver where I have two aging parents that live in Northern California. So I'm at a distance and I'm raising a child, and both my parents have chronic health issues, and I'm fully thrust into the ideal client that I was trying to work with and find when I was out selling home care services in the field.
I love all of this too because every business is hiring these sales reps and oftentimes struggles to because it's like, who is the person that is the right fit for this seat? And so I love to hear you kind of dial back like what you were and what you were doing and how those skills like translated from the gatekeeper to customer success to sales, because it's finding people like you, like kind of the diamonds in the rough that are out there that make a really good fit for this role. Tout yourself a little bit. You have like some major accolades. Like you're not just a like an average sales rep in San Diego. Like you grew and developed relationships that led you to, again, like some accolades. Like share a little bit more insight into that.
Okay, it's not natural for me to do that, but I'm happy to because it's been a journey, and I'm really grateful again for the mentorship that I've had along my way. I think my success as a sales business development person in home care comes from the leadership that I received and the support I had from my fellow sales members. So I had transitioned from that original home care position into the director of admissions for a skilled nursing facility. So I kind of put myself in this new role where it was very insurance based, helping patients discharge out of the hospital, and then realized that really home care was my passion. And so I left that and went back into the home care space. And when I was hired by Home Care Assistants for the La Jolla location, La Jolla and Cardiff, back in 2018, 17, that opened my eyes to this very high-end private pay, really concierge level white glove care management model of home care that I hadn't experienced in the past. And so with that, I was struggled at first. I went from more of a serving Medicare patients that were coming from home health, skilled nursing, and hospice referral sources and hospitals, where maybe they don't stay on services long term because they can only afford so much, or they get referred in a little too late and they don't stay on service long enough before they need to move, or maybe they pass away. And so I was used to this kind of churn and burn environment, which I think a lot of home care agencies experience. And it was challenging. It was challenging to grow the revenue. It was challenging to keep caregivers happy. And so when I moved over to Home Care Assistants and was introduced to kind of this different service style, I learned very quickly that there is a whole nother world out there of clients who have the means, who want to age in place, and that they have advocates and advisors and families that maybe can start that process sooner because they have the means, or maybe they're wanting to put the resources because the client is absolutely adamant about never leaving their home. And so now the families really have to figure out these in-home solutions to age in place. And so building that business, really working in that niche of more concierge level, was able to grow my annual revenue really by the millions year over year. I was there for almost 7 years, and my last year I was projected at least 8 million in revenue, and I left not even halfway through the year. So I have this great idea and this proven process that I'm excited to share with more home care agencies to say, let's diversify your referral sources. Let's look where there's people who have the means. And so you can build that foundation of business, and your caregivers can have jobs for years and reduce this retention issue that we see so commonly.
Okay, amazing. Two specific questions because you've lived and breathed this sales role, and we talk a lot about this in home care sales, but also just like sales holistically. First one is, what do we call this role? In home care, you see marketing, you see sales, you see business development, and you've already referenced a couple of the terms, which is fine. But if you had to like hang your hat on one title, what would it be?
I mean, the challenge is the role interfaces with not only referral sources and kind of transactional business, but you also interface with families. So the last thing you want to be called is a sales rep, right? I know hospice liaisons don't like to be called hospice sales reps, right? Because it's like those two just don't mix very well. And most of the people who are doing this work are not in it to be like crazy salespeople and numbers, right? We're here to help. So it is a challenging title, I will say that. And I've heard a lot of different things. I think when I try to define my title, I am a business developer. I'm a relationship builder and I'm a connector. So I'm all of these things. But at the end of the day, I'm there to develop the business for my agency that translates into care for our clients. And so I like a term that kind of bridges that gap, whether it's a home care liaison or it's a home care business development specialist. I mean, the titles are tough.
Yeah, and
I
it's
don't
all
like marketer though. I'll tell you that. I personally don't like marketer. It's probably the most common term used for the role. Marketers are going out slanging brochures. And I think as long as you're slanging brochures, you're really not developing relationships. And so come up with a title that defines you based on what your true value is to your referral partners. And to me, it's connection, it's relationships, and it's communication.
Yeah, that was great. And I love the hot takes and just defining this because you're right. I think we're overusing marketing and marketer in this role, and that's got to go. And we've got to transition into this more like sophisticated title, which you just defined so eloquently. The other question I want to ask is and this probably evolved over time, but what motivated you? Like a lot of sales reps are motivated by money financially. A lot of your income was probably commission based. At what points were you motivated by money, and at what points were you motivated by service and by the care itself and by the impact you were making? And then maybe like the overlap. Like is it 50-50 in that seed, or was it 70-30, or did that change over time? Like just talk about like your motivation and what motivated you.
I think I was motivated by winning. And it's not necessarily defined by how I win or how the company wins. It's just winning in general. And so if I could have a point throughout my day where I felt like I won that, or I walked out of that building and I won that conversation because we scheduled a follow-up, that is a win. I feel like my day, something good happened today. It wasn't a 24/7 referral, but it was a next step with a referral source that eventually will refer me a 24/7 referral. So I have to be patient and I have to count those wins. So I think it's winning. And when you're a field rep or a business developer and you're coming back into your internal team, into the office after being out for days, or you haven't seen them for a while, you want to come in with that winning mentality. I can remember so much positive feedback I got from my old teams. They'd say, Gabby, when you come into the office, we love it. We love the energy you bring. You bring us smoothies sometimes, or you just come in with a smile, you sit down, you ask how I'm doing, you share something positive that happened to you out there. And I think that is one of our roles as the outside person representing the company, is like, we need to represent inside as well. Our internal team are just as important as our external customers, and really creates that teamwork that is going to create growth and success for the company overall.
Amazing. Okay, love that as well, because winning takes so many different shapes. Like there is the financial gains, there are the service gains, there are the relationship gains. Like I love that concept of just like tracking the wins and being focused on the wins, because they look so different, but they're all like net positive, which is amazing. I ask you this partially too because the primary audience of this show is owners and operators, and they are the ones hiring these sales reps, training these sales reps, rewarding and recognizing them. I want you to share from your personal experience being in the sales rep seat. What were some of the misconceptions or misunderstandings from the owners to you as a sales rep? What were the things that you were doing that went unrecognized or misunderstood? Because I think a lot of that is happening. So I want to hear that from your perspective.
Okay, and I'm not here to harp on any past people, but it's a great question because I think we all feel these feelings, right? And I had a great opportunity when I was working with Aaron Markham at Breakaway 365 to work directly with about 8 or 9 companies across the country. And so I got to have owners in these coaching sessions, real and raw. And I'm still sitting in this, I've been a business developer for 15 plus years seat. And so I love this question. So there's a few things. One is often when we hire a business developer, you think that they're going to turn on right away because they're out in the field, they're energized, they're excited. But the reality is there's quite a long ramp period, right? They're building relationships. So you think about yourself, like Are you just going to give someone blind trust with some of their most important clients without really knowing them or having them prove that they're who they say they are and they do what they say they're going to do? And so it takes time. And I would say on average, it probably takes 12 to 18 months for a business developer to really turn on and have that steady stream of leads and that steady cadence of visits and intentional relationship building sales calls to see big ROI on hiring a full-time business developer.
Yeah, that's great. And just a good reminder for people. You said 12 to 18 months. This isn't overnight. This isn't even in 6 months. This is
No.
12 to 18 months to see them hitting their stride.
And then one of the other things I think that goes right next to that is sometimes the leader needs to ensure that once that referral comes in after a year of that BD person not giving up and building trust, the momentum needs to now like increase, right? And the owner has to get behind the entire team to say, here we are, we got an opportunity. Gabby's been out there at this account every month for 12 months and we finally got a referral. Let's go, team. Like, how are we going to make this the best experience this customer is going to have? And how are we going to communicate that back to Gabby to ensure that she can relay that information to the referral source? The ball gets dropped. Oftentimes, the referral comes in, someone takes the intake, and the business developer has no clue, right? It's not documented or there's no follow-up process. So keeping the business developer in the loop and in the process, and they also have to hold themselves accountable to following up with the internal team and understanding what's going on. But the leader has to understand that once you get that momentum, we got to build on it because we can't miss out on that opportunity.
The word that comes to mind is like integration, like the owner to the business development rep to then the clinical team and being a unit because, like you said, the ball can get dropped at all these different touch points, but you are kind of that connector. And so the owner needs to be on board with that and help with that integration. This is probably a loaded question, but what does the business development reps part look like in that like continuation? How do you stay connected through that process?
Well, each team works differently, but there should be some kind of communication thread. So let's say I'm out in the field and a call comes into the office and it's a new lead. Whoever takes that call has a kind of a script and a process. If they know it's from a referral source, they know it's something that could start right away, they're going to transfer it to my cell phone out in the field. They do a warm transfer. Hey, Gabby, it's so-and-so from the office. I have this lead on the phone. They'd like you to do an intake. And I'm pulling over, I'm dropping everything I can to take that call, right? But there's a process and an expectation that I've set for that communication. So that is one example. Other ways to get involved is really just having a weekly cadence to meet about the pipeline, to talk about the business and the health of the business. And I've talked about this in the past, but without a pipeline meeting, the business development rep is going to get surprised when their numbers go down, when the weekly hours go down, or when someone's all of a sudden in a hospital and nobody told them and they want to go into that hospital for a visit. Well, if there's no communication set up between you and your internal team, you're going to get disappointed and fret all the time. So set something up every week, same time, same day, mandatory. We go through the leads, we go through the assessments, we go through who signed on, who didn't sign on and why, and what the next step is, because we don't want to leave them hanging. And then we go into who's coming off service and why, who is in the hospital, and where do we kind of need to make up the difference. And so it's a strategic, what I call the pipeline meeting, and the business developer runs that meeting for the team. And you bring in the people who need to be there, who contribute to understanding the health of the business. And that could look differently. Usually for us, it was the care managers, it was a scheduling manager for part of the meeting, and then the recruiter for part of the meeting. So very streamlined, very intentional, no one's surprised, clear communication.
And back to the collaboration, is the owner involved in that meeting, or is the owner in that meeting maybe once a month, or where does the owner fit in that process?
As we know, every business is a different size and the owner has their own involvement. I think if the owner is involved in growing the business, which many owners are, right? If they're out there even doing their own business development efforts, they should be a part of that meeting. If an owner has capacity to do their own relationship building, they should, and they should showcase to the team what their expectations are as far as communication with those relationships. It doesn't mean the owner needs to have 50 accounts that they're out going to, but they could have 5, and those 5 could be very high end, very important. It could be the president of the Alzheimer's Foundation. It could be, a board member for the local hospital. It doesn't need to be necessarily a social worker in a skilled nursing facility. But I believe the owner, if they want to know the value of their team, of their, business development team, they should be present for those meetings, or at least the managing director of the office.
Okay, this is great. Weekly pipeline meeting. If you're not doing it, this is the place to start. Just to, like you're saying, just smooth that communication, make sure everybody's on the same page, and make sure there's no surprises that come up because home care is so fluid. Things are changing on a dime. Hours are up and down. People are offboarding. Like it's just so fluid. And so that is a must. And I like, yeah, jump in.
Let me add one more point to that because that is where you see opportunities for growth. And I think this is a huge missed opportunity for many companies and maybe for owners that don't really know how to see those gaps and opportunity for growth. So one of the ways that I think is not talked about enough and not measured enough is referrals out. We put a metric in place where we had a goal where our goal was 2 referrals a week that we would be referring our clients some other resource or service that we couldn't provide that they needed. And it would be strategic. Excuse me, it would be from referral sources that I had already vetted, that we had relationships with, that it was already reciprocal. But tracking that to make sure that you are also giving to your community to better help your clients age in place. And then your caregivers are identifying that for you. And you can say, hey, geriatric care manager, I just wanted to give you a quick update. Our caregiver reported a little skin breakdown on the buttocks. I know that you know her doctor. Could you please make an appointment or whatever the thing, but we're advocating. And it's not the staffing manager who's making that call. Maybe it's your care manager if you have it. But if not, push it over to the business developer because that's a reason. That's a touch call. Mm-hmm. That's an intentional call to build a relationship with your geriatric care manager. That can come from the salesperson, from the business development person.
I'm glad you added that in because we don't talk enough about this in home care. It's all about give us these referrals, getting these referrals, obtaining these referrals. We don't talk enough about referring out, but like you just said, it's another touch point. It's trust building, it's relationship building, it's making sure we're reciprocal. We're not just asking, but we're giving. And so it sounds like you said 2 a week, which sounds feasible, right?
Yeah, totally. And that could be anything, really. It could be a placement referral. It could be a private chef. It could be anybody. It could be a housekeeper, because your caregiver's reporting half of their day is spent cleaning. Well, in California, that's not allowed. It's only 20% of your time can be dedicated to housekeeping. And so we need to make sure we're bringing in a resource. And sure, maybe people don't think that a house cleaning service is going to refer you in, but I'll tell you in like pockets like La Jolla or Rancho Santa Fe, where those housekeepers and the staff at the homes really have the pulse on the client, the reality. And they can tell the daughter, hey, I noticed this and this, we get some extra help in or whomever. There's sometimes a house manager that can be a referral. So you just never know. And I think that, I think you're right. I think when we talk about KPIs, which is another topic, what are you measuring when it comes to how you're developing your partnerships? Not just your revenue, not just your caregiver retention numbers. Honestly, you're not going to have caregivers if you don't have clients and long-term clients, right? So exactly. I am very passionate about the front side, the client-facing side of this industry, because I think business development and sales gets really overlooked, but gets the blame, the first people to go.
And we're changing that right now in this conversation. This is a perfect transition. You're already name dropping all of these different referral sources. And so let's just get into the topic in more depth. And I'm going to kind of preface this. We want to talk about the referral sources that you drove a lot of success with that are less common. They're not the hospitals, the SNFs, the assisted livings. Like you actually drove a lot of your success through less common referral sources. But I think a lot of people that are about to listen to this are like, wait, tell us a little bit about the healthcare related referral sources. So I want to spend 10 or 15 minutes on the healthcare related referral sources that you focused on and what your approach with and kind of differentiators were there. But then we're going to spend the bulk of the time talking about these less common private pay referral sources that were wildly successful for you and why you targeted them and what you did with them and what worked long term. With that being said, just spend a couple of minutes talking about your top healthcare related referrers, who they were and why they were important to building probably kind of like your foundation so that you could go out and approach these different referral sources.
So, like I mentioned, I've worked alongside home health and hospice partners. And so I would say the number one was a home health partner, or two, or three. So I probably had three, and each one would be a different value for me or for the clients that I was going after. But the thing we always had in common were going to accounts that had qualified private pay clients for home care. So I wouldn't just go to any skilled nursing facility or hospital or doctor's office with the home health rep. I would be very strategic. We would co-market at neurology offices. We would co-market at concierge medicine offices. They would take me to the special unit in the hospital that took care of the donor clients and patients. It would be very strategic with where I was going to spend my time because, again, I was going after a very niche type of client and they're hard to find. And so going in with already a trusted referral source like a home health partner that built that relationship with the internal office team, at the account, and then would get referrals and refer me in. And so it was twofold. It was one, getting in front of people, and then getting the opportunity for a client lead, and then hopefully a new client. And then now I get an opportunity to go back to the office and say, hey, I met you last month. We provided lunch. It was so great to meet your team. Just want to let you know that we're going to be working with Mr. Jones alongside, XYZ Home Health, who referred us in because the nurse identified that the patient needed blah, 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 that home care can provide. Great. So now I'm building a relationship through a co-marketing effort with a client that is qualified and now has Parkinson's disease and is going to need a long-term caregiver for the next 5 to 10 years. So home health is number one.
The home health company was baked into your company, or this was like an external company?
I would say a majority of my private pay growing with home care assistants, and the key was external. So we would go in as kind of like a package for the referral source. We would say, we're here together, we work together, we identify needs together to best serve your patients and families. And the referral sources love that because now they're like, great, I only have one person I need to call. I'm either going to call Gabby, I'm going to call Joey. They're going to take care of it. So it's, makes it really easy for the referral source to pick up the phone and make the call. And that's the goal. I want it to be easy for my referral sources, right? Just want them to text me or call me, explain the situation, I take it from there. So as far as healthcare related, I would say home health. Hospice partners, very similar approach, very similar strategy. End of life, really knowing what your agency's comfortable with, what they're skilled with when it comes to end of life care. It's not something you can just throw around and say that you offer if you really don't have hospice experience and trained caregivers. So definitely making sure that you align with the right hospice partnerships. And then with hospice, one of the things that I leveraged was going in and meeting the clinical team. And so part of building that relationship and my efforts was going and providing a 5-minute education pitch to the clinical team at their at their IDG meeting with the physician, the social workers, the nurses, and everyone around the room who has the opportunity to make a referral or at least call the liaison that then knows me to make the referral. So that's a great way is you're able now to go out in the field with these two types of providers, but then also go into their internal teams and build relationships there. And then skilled nursing facilities, many home care companies are comfortable with that. I would say something that kind of set my approach apart was I really wanted to get the referral as early as possible because I would share with them that our goal is to come in and do caregiver training with your rehab team prior to the patient going home. And then also for free, we will go out and do an in-home assessment. And the patient's not even there, but we're going to go in and see the home. We're going to give you social worker, discharge planner, a really clear picture of what the home is like and make sure that it's a safe environment, or maybe you make referrals for now some equipment that you didn't know they needed. So we're bringing value because we're essentially making the discharge safer and reducing the liability for the patient coming back and being readmitted, which we know hospitals and skilled nursing facilities absolutely want to avoid.
This is so good. You're dropping in all these tactics of like exactly what you did, which is so valuable. It's like, what did you do to get into that hospice and to get into that sniff, and how did you approach it differently than, the 50 other home care companies that were approaching them, which is so good.
Yeah,
Go
so
ahead.
just to add to that, one more tactic is if I got a referral from a skilled nursing facility social worker, Not, I wouldn't say like, okay, great, we'll see them when they get home, or, we'll do the assessment when they get home. I would say, when can I come in and when can you introduce me to the patient and the family? When can we kind of have this collaborative meeting to all get on the same page? And again, you're slowing the process down, you're making it more thorough, and now you're giving your team an opportunity to staff and prepare that caregiver for that skilled nursing patient, because most patients coming out of SNFs are way higher acuity, they're sicker, they're weaker, they're way more volatile, and it needs to be planned out as properly as possible, right? And that requires training, because we don't want our caregivers to get hurt. We don't want them to be ill prepared. So I would often, as much as I could, slow it down and collaborate with the skilled nursing facility team, the director of rehab, the director of nursing, and the discharge planning teams to ensure a full wraparound experience. Connect with the home health that they're recommending. Oh, we're coming home with this patient too. What's your communication style? What do you expect from our caregivers? Let me make sure those protocols are set up. That was all me. That was my job. If I had a day like that where I'm coordinating discharge and I only got to see one or two people out in the field face to face, it was a good day. It was a win because we're helping someone get home.
The thing that I'm hearing too is it's a very different approach and process with each of these referral sources. And that's probably another just pitfall for these business development reps is I build a process and I apply it to each of these referral partners. But you said it at the beginning, what they value, what their outcomes are is different and you need to tailor your approach to their outcomes. That's a lot of pressure. That's a lot of work. You just said it yourself. Like that is a lot of work day in and day out. But that should be the end goal is how do we create and build a process that's specific and tailored to that referral source and ties us directly to their outcomes and to what they value.
And this is exactly why it takes 12 months to 18 months, because the business developer is doing their due diligence and having intentional meetings and asking all of these types of questions as they go month over month out into those accounts. And so having questions prepared that allow the person to get an open-ended answer and just, what are your pain points? What are the biggest challenges? What is working well with the home care providers you're referring to today? What are some gaps that you see? Let them tell you and just gather intelligence and document it. And then their next visit, you have an intention to come back and address one of the things that they told you. But if you don't ask, and you just drop your brochure off.
You look like everybody else. The other one that you mentioned that I just thought was interesting that I want to draw a little bit of attention to is this concierge medicine practice. That's kind of transitioning us into maybe the less common, but it's still healthcare related. Who is that and why was that valuable to you?
Yeah, so concierge medicine patients are all private pay. So they're paying an annual membership fee. It's usually between $10,000 and $50,000 a year just to have access to the doctor and the team. And then they're paying out of pocket for all the appointments, all the tests, all the labs, all the x-rays. But they're getting the best referrals to the best specialists. They're getting concierge treatment, in facilities. They're having house calls. But the biggest, for me is I used to go to all kinds of physician offices, cardiologists and internal med and kind of these big practices. Well, most of these concierge med practices, they have a cap in how many families they serve. And many of them serve families, one told me this term, so I'm going to say it, from cradle to grave, right? So they're helping generations of families. They're helping the pediatric patients all the way up through the geriatric patients. And so what a great place to fish where the fish are. What a great opportunity to serve these families that are your ideal customer already. And then they often have a nursing coordinator. You can go in and provide those lunches and in services. And I've gotten some amazing kind of VIP clients from these referral sources that were such a pleasure to work with.
You are in a highly saturated market, I think what people would refer to you as. But are these healthcare referrers, are they tapped out? Like are people missing out on these opportunities because they're literally tapped out? Do you think there is room to get in your foot in the door in these places, or are there some markets where it's just tapped?
I mean, I think that's a fear or something that maybe holds business developers back is they say, do you work with an agency? Oh yeah, I already work with 3 companies. I don't need another one. Well, the art of asking open-ended questions is learning from that answer, right? And so what we also know is that people move around a lot, and this industry is not stable for anyone. And I don't see anywhere near in our future where it will become more stable. Then the needs are going to grow. So if you are not bringing value or intention to the burnt out or the overwhelmed social workers and nurses at these facilities, don't go. Like, don't waste their time. And that may be harsh to hear, but why would what are you going to get? You're going to get someone that's probably just going to be like, can you just bring me lunch? Can you just bring my team lunch? And sure, I'll bring you lunch, but can we work on a client together first? Happy to do that. But can we work together first? But I think that's probably a common response. Yes, host this for my team or host that. But that's not, for me, the right value. The right value is, how can we better your patients' outcomes? How can we help take something off of your plate? What would be the easiest way to do that? So yeah, I think you have to be incredibly intentional with people's time.
So my follow-up question to that is, do all home care businesses have to have a base of these healthcare referral partners, or do they not? Like, did you have a base that was coming out of this, or have you worked with businesses that don't have healthcare referral partners that can have a strong foundation? Like, it's not all or nothing, but like, do you have to have some of this to be successful?
I think too, it depends on your business mix, right? I know a lot of your audience, they have Medicaid contracts and VA contracts. And so their ideal customer is going to be coming out of a healthcare account, right? A lot of times early planning is not involved in typical Medicaid patients, maybe, or they don't have the means to do that. And so I think you do need to tap into the industry at all facets. It's so important to have the relationships in the right places so that you can make referrals out. Again, like I said, I can't tell you how many of my trusted advisor referral sources, like an attorney or a financial planner, would call me asking, hey, what's the best memory care? I actually had a call from my own financial planner this weekend. I need to move my mom into memory care in this part of town. Do you recommend any of these buildings? So just because they don't give me a lot of business, it's still to make myself more well-rounded, to serve my clients, to make connections out there, to know the industry as a whole. You do need to be connected in some of the right places. But I think I've said this in a previous podcast. I used to work with maybe 5 to 7 SNFs in San Diego over my last 8 years in home care sales. There's over 500, if not more, in San Diego. So I'm only focusing on the ones that I would put my own loved one in, so I can authentically make that referral to a family.
Yeah, that's a really good answer of you saying, like, becoming that connector. You can be passing business back even if they're not passing business to you, but it comes full circle in different moments where it all works out for both of you. Um, on the kind of tactical note, you mentioned they put up these walls. They say, bring my team lunch. They say, I already have 3 home care businesses that I'm working with. Like, in a nutshell, what was your secret sauce in those hard moments? Like, was your arsenal just asking these open-ended questions, or were there other like quick things that you would do to break down those barriers?
Got it. Love this question. I think a lot of times business developers think that the social worker in the skilled nursing facility is the only person that they should be focused on, because that they're the ones making the referral for the patient to go home. They're in charge of that. I think that one of the best ways to get around it is you need to be well-rounded within the community itself. And so, like I mentioned earlier, I intentionally went and made effort to get to know the director of rehab. I would actually host mini educational sessions, or like a key with just the rehab team, just the PT, OT, and speech therapists. I would do the same. I had a great relationship with the director of admissions and marketing, because she was the one out in the field going into hospitals, so we could co-market. But she also would call me and say, hey, we're going to need a 24/7 sitter because we have a high needs patient coming in, and can you guys staff? And so we would always say yes, and we would show up. So the refer isn't always just one person. And so I think if you know the account is qualified, and you know that your ideal customer fits the demographic of the majority of the patients in that community or building, then it behooves you to really spread yourself out and develop relationships with each department, including the gatekeeper. I'll tell you, at this one skilled nursing facility in La Jolla that I've worked with for 8, 9 years, they're always right down the street from the office. So I got to know them regularly. The gatekeeper, Dino, he was at the front desk for probably 4 years, and then he got promoted into a new job, and then he got promoted again into another role, and now he's the director of staff. So he runs all the staff. And so you just never know. You've got to spread yourself out a little bit. Same in any account. There's going to be more than one person that has the opportunity to refer you clients. It could start with their own personal referrals. It could be someone that doesn't even live in the community that they're in, and you just never know. So don't put all your eggs in one basket and spread yourself out a little bit.
And I love this term that you keep using, which is like co-marketing with your partners. Like, I
Yes.
think that is also a huge differentiator for you that you're explaining here is you go out and approach a referral source with one of your referral sources. Like you are a unit and you are building those relationships to go out and create and foster more relationships. I think that is like an underutilized lever likely in home care right now is co-marketing really tightly as if you are a unit, as if you are on the same team. Essentially, you are, but as if you were working representing the same company to go out and approach new referral sources with your existing ones. Like, I think that is just so powerful.
You can kind of picture it as like having a power partner. I think having your solid power partners is so important to really cementing yourself in your market and having these relationships that then can develop and blossom and bloom outward, right, from the beginnings of those relationships. So yes, it should be a home health rep, it should be a hospice rep, a skilled nursing admissions person, memory care communities, those as far as the facility type settings or the living settings, and then having estate planning attorneys and having financial advisors. They all like to network too. So I know we can kind of touch on this down the line, but where can you go out and get yourself in front of more people with someone else? Because warm introductions are key. I can't emphasize how powerful warm introductions are. And so it takes being willing to ask for the warm introduction and then identifying when there's an opportunity.
Let's transition to the non-healthcare related referral sources because again, this is part of where you just thrived is going out and finding these less common referral sources. So I think there's three or four that you want to talk about. Let's start with the geriatric care managers. I think a lot of people are familiar with that role, but why was that particularly beneficial to you?
So when I joined Home Care Assistance, I was opened up to this world of geriatric care managers. And I really kudo the organization and my former leader, Ashley Marone, to help educate me to get comfortable and get out there in front of these folks. And one of the best ways is to learn about what they do and realize that it is probably one of the most powerful relationships you can have in home care when you have these folks in your area. I know there's a lot of rural areas across the country, but I have a feeling this role is going to become more and more needed and created by people who want to help older adults, with their aging needs. So GCMs are the best for home care companies because they're working with your ideal customer already. Their services are all private pay. Their job is to advocate and help manage the care. So they're the ones often bringing the home care referral and the home care agency in and then keeping them there and then addressing issues as you go. So developing relationships and then processes for the internal team around the specific geriatric care manager partner was something that I learned to be very effective in getting long-term clients that were going to build very high revenue. I think the average revenue from a GCM in a year was probably close to 150 to 200,000 for one patient or one client. So they're big clients typically. And the other great thing about GCMs is, again, what a great opportunity to refer your clients to someone like them. So what they do, one of the things that they do that home care companies, at least in California, don't do, is manage medication. It's often such a challenge and a short-term need to fix for so many issues that the patient's having. The caregivers, we can't touch the medication. So bringing in a GCM, initiating that relationship by saying they can come and help manage the medication. They can then go with you to your doctor's appointments and advocate and take notes and then report back to your family. Talk to all your providers at once and kind of quarterback, because we know people have many, many providers at once. They often don't communicate with one another. So it's the geriatric care manager's role to be that conduit of information and ensure that the patient is, wishes are being addressed, their quality of life is being addressed, which oftentimes providers, that's not the first thing. They're just trying to treat. So there's a lot of really great ways to work together with a GCM. We would have one of our partners come in on a monthly basis, and we would pay for their time, $200 an hour, $300 an hour. And I would have them come and sit with my own care management team, the internal team, and we would all talk about a challenging client that we had and what to do. And so they could provide information and strategy. It could be a possible referral. Obviously, HIPAA and all that was very compliant, so there wasn't an issue there. But again, it was like, why not leverage these professionals to help us do a better job helping our clients and our caregivers? So I'm a big fan of GCMs, also known as aging life care managers. They have local chapters throughout the country that you can get involved in. I was a part of the educational steering committee here in San Diego for many, many years. It was a monthly meeting. Got to sit around a table with 5 or 6 GCMs, got to help plan the national conference that was hosted here. Just got access to these people in ways that I had no clue was possible by just putting myself in the arena.
Yeah, I'm glad you just mentioned that Aging Life Care Association. And you said it at the start, education is so important because in home care, care management is a little bit gray. Home care agencies sometimes touch like a little bit of care management, might be doing too much where they should be billing for it. In your case, you were partnering with these geriatric care managers. Some other home care businesses have care managers on staff and bill both. So I think the best place to start is just like educating yourself on what is home care and what is care management, and establishing where everybody fits in the care that's actually being provided. But I think you're right. If you are a home care company and you don't offer care management as a service, then you absolutely need to get connected with these GCMs, build these relationships, get inside of those meetings, because they are optimal partners for home care businesses.
They really are. And one of the great things that through that educational steering committee, I got so comfortable with a couple of them. When they called me to refer a client, they would say, "Can you come do the assessment with me? I want us to go together." And that was just such a great opportunity to really learn even more about what they do, because now we get to essentially do the sale, business terms together to wrap our arms better around this family and this client situation. It proved to create very high value lifetime revenue generating clients, more than probably any other referral source I've experienced. Yeah.
How many GCMs would you say you were working with kind of at your max?
Probably 4, and they all offered something different. And so when I wanted to refer out to them, I would typically understand what the need was. There's one firm here that is very nursing focused. All the care managers are nurses. They don't necessarily do the bedside nursing, but they take more complex, high acuity clients. And so they are always going to need caregiving support, right? Great. We have another firm that's all mostly social worker based, and they have a sliding scale payment plan, and they have these different activities and different connections that just depending on the client, they could be a better fit. There's one that is owned by a former doctor of physical therapy. So she hires her team to be very rehab and therapy focused. Not that they're providing the therapy, but they're coming with that perspective for a patient or a client who has Parkinson's disease or mobility issues. So getting to know each, it's just like in home care, you have to have a specialty. You have to have a unique value proposition. And that is going to set you apart more than anything today, right? And it's your story and it's your why. And so when you partner with a GCM, they need to know that too, so that they can appropriately refer you. I mean, if a GCM had a lower income client that couldn't afford our rate because we were at the highest level of the spectrum in San Diego, she's not going to refer that to me. It's not because she doesn't like me or we don't have a good relationship, but she's very clear on who we want to work with. And that's the two-way. And I developed that relationship and nurtured it outside of the ALCA opportunities by just having one-on-one opportunities. And then that built them calling me and saying, let's go do this assessment. I'd like to introduce you to my client personally. And I mean, what better, honor than that? Someone who's worked on this relationship for a long time.
Yeah, so good. Let's talk about two other non-healthcare related refers that you were successful with, and you've kind of mentioned these a few different times. One of those being wealth advisors, people that are helping with that end of life wealth planning. How did you find those people, and why did they turn out to be a good fit for you as well?
Again, they're working with clients to plan for retirement, to protect their assets and their estates. And those are the clients that we want to work with. And it's not going to a banker necessarily, but a wealth advisor is often a more comprehensive financial professional that their clients typically have a higher net worth. Usually there's a minimum, either it's $1 million or $5 million, all the way up to, ridiculous buku bucks. And so they making the referral for them, that money issue, that financial issue is not going to be the hesitation, which I think is probably 90% of the hesitation why home care liaisons don't get referrals from SNFs is because they say, my patients can't afford you, private pay. Do you have a contract? I got that all the time. So that's why I stopped going. Shifting my focus to wealth advisors are working with families. They have that trust built, and they're looking out for the client's legacy, which often looks like staying in the home long term, bringing everything in, and really ensuring that the client's privacy, dignity is staying intact, and that their wishes are being met. A lot of times, the wealth advisor client will also have a concierge medicine doctor. Great. Well, now I have 2 touch points on 1 referral that I get to work. And then they probably have an estate planning attorney who's in charge of the trust, possibly. That trust is what pays our bills. So, wealth advisor, could you please connect me with the estate planning attorney so I can ensure the document is signed for the bills or whatever it is. Oftentimes, the wealth advisor is also the one paying the bills, depending on the situation. So it's very important to start getting out into the world, into this financial world, and then the legal world. And I think more than ever, with the amount of people who are retiring and aging who don't have family, really getting into this trusted advisor network is going to be key to helping people who have the means to get care long-term in the home and stay at home long-term.
Yeah, so money is not the issue with these people.
No.
What are the most common concerns you would hear from these wealth advisors, or what were the concerns that you were breaking down? Or was it the education piece? Do these people know a lot about home care? Or you're coming in there and you're like, let me explain to you what we
Yeah.
do.
Yeah, I will never forget. This was such a cool experience. I think I may have cold called a firm, and it's an international firm branch here in La Jolla. And I called them. I got an appointment somehow. I walk into the appointment, and there's 3 wealth advisors, all men, probably 50 plus. And there's an ocean view, and I'm at this big oak table, and I kind of feel out of my element a little bit. And they bought lunch. I didn't bring lunch. I was like, ooh, they're rolling out this red carpet. And so I, had some things I had prepared, mostly just to ask them questions. The conversation quickly turned into the most kind of, for me, basic understanding of what insurance covers, Medicare, private, long-term care insurance, and what it doesn't. And we probably spent 45 minutes, and their jaws, they had to keep picking their jaws up, knowing what it costs to have 24-hour care for a month, which in San Diego, it's about $30,000 to $35,000. They had no clue. They were very uneducated when it comes to what I'm very educated and knowledgeable about. So I positioned myself as, I'm your go-to elder care healthcare expert. You call me when one of your clients has a significant change in condition or receives a diagnosis like dementia. You call me when one of your clients goes to the hospital and wants to avoid the skilled nursing facility and needs kind of hospital to home care. You call me. I gave them a few examples of when to call me. And then maybe a few months later, I get an email. Mrs. So-and-so is in the hospital. She's my favorite client. She's 95, a former physician, lives in Coronado. I'm on it. Great. He's like, I don't know what she needs, but she's there. Here's the daughter's number. And it was a 2-month process to get her home because she kept having reinfections, but we got her home, 24/7 care. amazing woman, was like the first female OB doctor on Coronado. So just such an opportunity, right? And it turned into a great case, and it took a long time, but I will always remember that client probably for the rest of my life.
And where that all started, what a great visual of you going into that office and feeling out of your depth. And then
I was going to get
here you
schooled.
are, the expert on the things that they don't know enough about. And what a perfect relationship. And just that trust was built from day one. Like Gabby knows her stuff, not just with private pay, but you could also share the numbers on Medicaid and VA and insurance coverage. Like you were the expert on all those topics. And then they see you as that trusted advisor. And then they're passing an amazing referral to you. Like that is just
Yeah, it was
incredible.
magic.
It's magic and unforgettable. I can only imagine. Let's talk about attorneys. Attorneys is another huge opportunity that's maybe some are missing the boat on. What's your experience working with them? What were the conversations like? What are their pain points?
Attorneys, similar in some senses, but often are a bit deeper, I think, when it comes to knowing the challenges of the family. Wealth advisors, it's a lot about money and assets and stuff. But attorneys, it can get messy, right? It can get messy fast when someone passes away and family comes out. There's a lot of dynamics, and so I would focus my efforts on meeting and building relationships with estate planning attorneys, because they're the ones whose job it is to create the protections and also the wishes and enshrine them, in legal documents, ensure that the clients have powers of attorney for health and for finances, which are two forms that should be required to collect when you're providing home care services, so you know who the decision makers are, which I don't think as many home care companies have that as a part of their comprehensive assessments, and I think it's really important, especially when you're going after these high net worth private pay clients. And so they really understand the wishes, goals, and the needs of their clients and the family dynamics, and they're messy. And so home care comes right in again as that expert when it comes to resources, and they also are great networkers. I've networked, I've co-collaborated, I haven't co-marketed, but I've presented with estate planning attorneys. I've had them come and present, actually had one come and present to the national sales conference that we had with the key. So they can come and talk about their process and how you can help protect clients and families in your service delivery and process as well with home care.
So, so good. There are these kind of less common referral partners that you have tapped into and built process with. And I think a lot of people hear this and can start here, but also it just spurs like ideas of, okay, attorneys, what does that translate into? Or here's our ICP. Here are the other people in our community that are touching our ICP, and how do we go approach them and drive value back to what they're doing? I want to take you back to kind of your peak when you were in the business development seat. We just talked about all these different referral partners. I'm curious if you can recall the breakdown for you personally, like where all of your business was coming from. When you were at your peak, what did your pipeline look like, broken down by the referral sources, if that makes sense?
Yeah. So we had a very large high-end senior living community that was a large part of the business. So senior living, not necessarily a health care, an acute care or post-acute care account, but a CCRC or a continuing care retirement community that had multiple services within the community: independent, assisted, memory care, and sometimes skilled, or often skilled as well. So a few of those accounts became very dominant when it came to referrals, because we would just be able to build upon the census that we had. I would intentionally have activity in those buildings on a weekly, monthly basis. But then I would say, and I would say when it comes to volume, you're not going to see a high volume from non-healthcare accounts, and that's okay as long as what you do see closes and becomes that ideal client with the long-term revenue. And I would just encourage owners and business developers, if you aren't super crystal clear on your ideal customer, you're not going to find them. And it took me a long time to really realize that. One of these fun activities I remember doing at Home Care Assistance with our operations leader was she developed like a persona. And I remember it was Caroline, the daughter. And it was like Who is Caroline? And she's a retired executive, marketing executive. She lives in Malibu. She, kind of her demographic. She's the only daughter. She has one brother who lives across the country and is not involved. She's making all the decisions. She's this, and this. And so we actually scoped out who the ideal customer is in order for us out in the field to better identify who we're going after. And I think that exercise is really powerful to keep the business developer focused on who they're going after. And again, if you get two 24/7 client referrals that start and stay on in a month, and that's all the business you get, that's way better than 10 2-hour shifts or 4-hour shifts that don't stay on more than 30 days from a hospital, right? So everybody's business is different. I think you can really make up volume with quality when it comes, and you find the quality for private pay often in these trusted advisor channels.
Yeah, that was a really good reminder about lasering in on your ICP. I talk to agencies probably every week that say, we're getting a lot of like this type of client, we're getting a lot of this type of hours or this type of business. And my mind always goes to, that's who you're attracting. It's your messaging, it's your marketing, it's the conversations that your business developer is having out in the field. Those are the people they kind of are confused. Like, I'm not sure why I'm getting all of these types of people. And I just think it's so backward. You haven't defined who your ICP is, and your messaging and your marketing and your sales efforts are attracting those types of people, not, who your ICP is. So it's just a really good reminder to laser in on that. And that is probably a huge driver of your successes. You were so clear on who your ICP was. Therefore, you were so clear on who your referral partners could be or should be that we're going to lead you back to that ICP.
I was so clear that I could tell within the first 15 to 30 seconds of a conversation with a new lead whether or not this was going to be a potential client for ours. And I would not have a conversation for 30 minutes if I knew at the beginning that it wasn't going to be. I would listen and I would say, as much as we would love to serve you, I don't believe, we're the best option because of these reasons. However, I have these two agencies that I would highly recommend that I would love to put you in touch with that I could have give you a call later today. It's being okay with saying no to the non-ideal, because if you're saying yes to your non-ideal customer, you are going to create so much stress and wreak havoc on your internal team and on your salesperson and you as an owner and a leader. And so I think this exercise, if people don't do, you should probably do it quarterly, and really be able to hone in and then develop other personas. You're like, wow, we've gotten 3 clients that all have this in common. We've never seen this before. We've never seen this diagnosis before. We've served in this area before. What can we pull out of that to give to our recruiting team so that they can continue to hire the right people for this type of customer? So it's getting your whole team involved in that conversation as well. I mean, who do your caregivers want to work with, right? And how are you evaluating that? So there's a lot of fun, I think, that can be done with really digging into this ideal customer. And then you don't question why you're not growing.
And you're not wasting time. I was just thinking that owners are so hung up on sales activity. What are our sales reps doing out in the field? But like you just said, if you know who your ICP is, you're not wasting time. You're not spending 30 minutes with a contact that you should be spending 5 minutes with because you know that they're not a right fit and you're walking away early rather than wasting time. So many good reminders and nuggets in what you just shared. A couple last questions here. You have been in this sales world, home care sales world, for, like you said, 17, almost 20 years.
Yeah.
And things have changed and evolved post-pandemic, technology, like there's all these factors that play into this topic. I just wanted to give you a couple minutes here towards the end just to share any interesting observations or things that you're keeping the pulse on that you're still seeing just when it comes to the home care sales landscape.
Yeah, a lot. We are in an exciting time in home care. I feel like the progress and the momentum and the innovation we've seen the last few years, the technology, this is just the beginning of more to come. And I think it's great. And I think when you have people like you who create this platform to really understand and vet what's out there, it's really helpful because it can get overwhelming really fast. But at the end of the day, it's not about selling hours or tangible services. In my experience, and especially towards the end of my days, is people want to know what the outcome's going to be. Is my mom going to be okay? How am I going to get my mom to accept care? Well, let's come up with some outcomes that we want to see, and then let's measure those for your mom. We also have to be really flexible. So, baby boomers and millennials, who are the decision makers for care or the ones receiving the care, they have very different expectations than the 90-year-old, what is it, the silent generation had. They're willing to speak up, they're willing to do their research, they're not just taking an order for someone, they have a lot of choice. And so all of those things are really important. And so how are you creating flexibility? How are you meeting those needs? And how are you asking and finding out what it is they want? I think technology is something that home care owners and agencies are going to have to lean into, not only to streamline efficiency in their operations, but really on the client facing side. I told you earlier, I met with a tech company that's really exciting to me to help solve the problem of reducing the fear of invasiveness and privacy while also providing monitoring, updating, and information, real-time information to promote safety in the home and really help age in place. And like, what a wonderful, ancillary service for a home care agency to provide or include as a part of their service, and give the family who lives in New York and their mom is in California the peace of mind that they can tap in or say hello or get a reading on a blood pressure or something from afar. So I think that those are some of the exciting upcoming things. And with private pay, people will pay for that. So don't shy away for upping your rate for including these services, or coming up with a way that you can actually sell this and charge what you need to charge to run your agency the way and grow it the way that you want to grow it. And people understand that. If they're seeing value, they're going to pay for it. And reiterating the message that customers, if you're going to spend money on anything, spend it on your care and yourself, and like, for the value, right?
So good. I could just keep listening, Gabby. You're incredible. This is why I come to you for these sales topics. And I just want everyone that's listening to this, a lot of agencies struggle with this sales role. A lot of owners come from various business backgrounds, different industries, and there's always this hang up with this business development function in home care businesses. And you have just like knocked it out of the park in your own experience. And now here you are kind of giving back this knowledge to other owners and operators. And so I just, put the plug in. If anyone is struggling with this function, like, Gabby is a resource to you and to your team to build out these processes, think through these tactics, think through these referral partners. Who is your ICP, and how do we go out and find new unique partners that can drive business back to your ICP? So I just think the world of you, and you're so knowledgeable in this area.
Can I offer
You
one
are,
more tip?
yeah,
Just a,
absolutely.
a very common challenge and something that salespeople here, business developers, is the financial piece, right? Nobody likes to talk about finances. Nobody likes to talk about how expensive this is. People get sticker shock when you quote them the rate. They're like, "Oh my God, I didn't know it was going to be that much." If you as a business developer, or your team who's doing the assessment and receiving that, confrontation, if you don't have a value-based answer to give because you don't know your team well enough, you don't know the service that your caregivers are delivering enough, you can't pull examples of value from other customer experiences, you are doing yourself a disservice and you're not going to sign people up. I highly encourage people to spend time understanding the clients that they're already serving and really leveraging those stories to overcome objectives, that's the word, with new customers. Because people don't know, they just hear a price. But if someone quoted me a price and then explained to me, and I understand the value because it really serves what I need, and that would be a good use of my money, even though it feels really expensive, I'm probably going to go for it, or at least I'm going to try, right? And so it's really important to have a good comeback, a good story to tell, an experience that one of your customers has had, to show the value of that cost and not get stuck with the financial objection piece.
You just took me back to the minimal sales training that I've had. It's like objection handling. You have to become a master at objection handling. And you did that. And it's oftentimes the price and the finances. But that shouldn't surprise you as a business development rep. It's like, oh, I have this memorized. I know exactly what I'm going to say to this, to come back with a story that just removes that objection.
Absolutely.
Gabby, last thing, you are starting a new venture. Give us a teaser of what you're up to now.
Yes, so I love this topic. I love this field. I am so grateful for the mentorship I've had and the success that I've had and the impact mostly that I've had in my community. And now, greatly meeting you and your podcast and networking with people around the country. I love this industry and I don't want to leave it, but I'm trying to find my right fit place. And with all this experience, 15 years of being boots on the ground and working with agencies from startup private pay through big national corporations, I've got a lot of experience and testimony to give to what I believe works and how to encourage more people like me to get out there and do it and grow and be successful and help more people and hire more caregivers and create sustainability in this care economy that is scary. There's a lot going on. So I'm hoping to do that with more people across the country in the form of a business development consultant. Yes, I'm developing my own consultancy. I am really looking forward to working with more owners who want to grow their private pay and do it in a sustainable, lasting way, coming from relationship building and not brochures.
Amazing. And it's called?
It's called Trail Angel Partners, which does not have the word care in it. But Trail Angel, it's a metaphor for when my husband and I hiked the Pacific Crest Trail, which was a 2,600-mile, 5-month journey in the wilderness from Mexico to Canada. Along the way, we were so graciously surprised by the support and the love that perfect strangers would come and support hikers, whether it was putting out a chair with a cooler of ice water in the middle of the desert, giving us a ride into town, letting us shower in their outdoor shower and pitch a tent in their yard and feed us meals. Trail Angels really became an essential part of our journey to reach our goal. And so I hope to metaphorically be a trail angel when it comes to business development guidance for this industry.
I love it so, so, so much. And it's early days.
Early days.
If you want to learn more or connect with Gabby, again, she's an open book and she's so responsive, which is one of the things that I personally love most. Is you can reach out to her on LinkedIn. We'll drop her email also in the show notes so you can connect with her directly. And again, if sales is your struggle, if you have questions or concerns or need help fleshing out strategies and tactics, I really believe that Gabby is the one for you. So Gabby, thanks for joining me in the lab. Always a pleasure for me. And I look forward to just continuing to follow your journey and see what else you can accomplish.
Thank you, Miriam. It's been so fun.